Afternoon, everyone. My name is Dana New, and today I will be presenting a crucial policy reform proposal that addresses one of the most pressing public health issues in our nation, maternal mortality, especially among women of color. The proposal I bring to you today is a comprehensive maternal health Medicaid Act. It is designed to tackle inequities in maternal health care that has gone on for too long. So this reform is not just about extending the care, it's about saving lives and ensuring that every mother has the support and resources she needs throughout her pregnancy and postpartum journey. To understand why this reform is necessary, let's examine the current state of the maternal health in the US. Maternal mortality rates in this country are significantly high, especially for a developed nation. However, the burden of this crisis is not equally. Women of color are 3 to 4 times more likely to die from pregnancy related causes than their white counterparts. And this disparity is not a result of biological differences, but rather the outcomes of the inequalities in our healthcare system. These women face barriers to accessing quality care. They encounter healthcare providers who may not understand their cultural needs and often have fewer options when it comes to choosing their healthcare providers. The result is a healthcare system that fails to serve some of our most vulnerable populations. Our proposed reform is centered on expanding Medicaid postpartum coverage from the existing federal minimum of 60 days to a full 12 months nationwide. This extension is critically important because it directly addresses the significant gap in care that many postpartum women, especially low-income women of color, currently experience. These women are more likely to suffer from postpartum complication, yet they often lose access to necessary health care services just months after giving birth. By extending the coverage to 12 months, we aim to reduce both maternal mortality and morbidity rates, ensuring that all new mothers receive the continuous care that they need during this vulnerable period. So breaking down the specifics of this reform just by using the SMART framework, we are calling for all states to be required to comply with the expansion of the comprehensive maternal health services under Medicaid. This include both prenatal and postnatal care, ensuring that every aspect of women's maternal health journey is covered. Our goal is clear and quantifiable. We aim to reduce maternal mortality rates by 30% over a 10-year period. This significant reduction will be the key indicator of the reform's success. This reform leverages existing Medicaid programs and federal funding, making it feasible to implement. By building on established system, we can expand accessibility without the need for an entirely new programs. Rather than creating new programs from scratch, we propose updating and improving the existing frameworks. This approach ensures that the reform is not only practical, but also sustainable in the long term. Lastly, the implementation of this reform will occur over a 10-year period with annual evaluation to monitor progress and make necessary adjustments. This phase approach allows for careful planning and continuous improvement. The subpopulation that we are focusing on with this proposed reform is low-income women of color. This group is particularly vulnerable when it comes to maternal health outcomes. Women of color face significantly higher rates of systematic inequalities that impact their health, including limited access to quality healthcare, higher rates of chronic conditions, and social determinants that place them at greater risk during pregnancy and postpartum. These inequalities are reflected in alarming statistics that show women of color are more likely to experience severe complication during and after childbirth. And tragically, they are more likely to die from pregnancy-related causes than their white counterparts. These barriers they face in accessing quality care, whether it's due to financial barriers, lack of culturally competent care, or other factors, it exacerbate these risks. This is why our reform is specifically targets towards this subpopulation. By extending Medicaid postpartum coverage to 12 months, we aim to provide these women with continuous care, and anything they need to lower these risks and improve the health outcomes. The health indicator we are targeting is the reduction in maternal mortality rates among low-income women of color. As we know, this group is at the highest risk and has the most to gain from the proposed changes. By focusing on this population, we are addressing the most significant disparities within the maternal health landscape. In terms of the iron triangle of healthcare, our reform primarily targets quality of care and accessibility by ensuring Medicaid covers a full year of postpartum care and includes culturally competent providers. We are directly improving the quality of care that women receive. At the same time, we are making this a high quality care more accessible by removing the financial barriers that often prevents women from seeking help when they need it the most. The overall impact of this reform will be substantial improvements in maternal and child health outcomes, especially for those who have been marginalized by our healthcare system. To make this reform a reality, we need a strong and strategic advocacy plan. Given that Medicaid is a federally funded program administered by the states, our primary level of advocacy will be at federal level. We will focus our efforts on the U.S. Department of Health and Human Services, which oversee Medicaid and has the authority to implement these necessary changes. However, federal legislation is crucial for ensuring nationwide impact. Our key influencer in this process will be Senator Patty Murray, the chair of Senate Health, Education, Labor, and Pension Committee. Senator Murray has a longstanding commitment to healthcare reform and has been a vocal advocate for maternal health issues. Her leadership and support will be instrumental in passing the legislation needed to expand Medicaid postpartum coverage. Building a strong coalition is essential to the success of our advocacy efforts. We plan to partner with the March of Dimes, a highly respected organization with a proven track record in maternal and child health advocacy. The March of Dime has both the expertise and the public support needed to rally the community and engage policymakers effectively. By joining forces with such a powerful ally, we can amplify our message and ensure that our reform reaches the widest possible audience. Our coalition will also include other community-based organizations, healthcare providers, and patient advocacy groups, all of whom share our commitment to improving maternal health outcomes. Now, let's discuss the specific action that we will take to advocate for this reform. Our primary activity will be organizing a nationwide letter writing campaign targeted at policymakers. This campaign will involve mobilizing volunteers from across the country to write letters to their local and federal representatives, urging them to support the Comprehensive Maternal Medicaid Act. We will provide these volunteers with templates and script to ensure that our message is clear, consistent, and compelling. Additionally, we will collaborate with advocacy groups to expand our outreach and engage as many people as possible in these efforts. Now, however, we do anticipate challenges, particularly from political opponents who may prioritize cost-cutting measures over expanding healthcare services. To address this, we will emphasize the long-term cost saving associated with reducing maternal mortality rates. By preventing maternal death and severe complication, we reduce the financial burden on the healthcare system, making this reform not only a moral imperative, but also a fiscally responsible one. And to sum up this pitch, in conclusion, the goal of this policy reform is to address the significant disparities in maternal health outcome that present across the United States. Despite the progress made in many areas of healthcare, maternal health remains an area where inequities are evident. These disparities are particularly pronounced among low-income women of color who face higher risk of complications and mortality during after childbirth compared to their white counterparts. Our reform is specifically designed to target and address these inequities. By focusing on the unique needs of low-income women of color, this policy seeks to achieve three primary objectives: lowering maternal mortality rates, enhancing the quality of care, and ensuring fair access to essential services. The first and most critical objective is to reduce the rates of maternal mortality among women of color. These women are currently 3 to 4 times more likely to die from pregnancy-related causes than the white women, a statistic that is both unacceptable and preventable. Through extended Medicaid coverage and socially competent care, we aim to provide continuous and comprehensive support throughout the postpartum period, significantly reducing these mortality rates. The second objective is to improve the overall quality of maternal health care. Women of color often receive care that is not only less accessible, but also of lower quality due to systemic biases and lack of resources. By ensuring that Medicaid covers a full 12 months postpartum, we can provide these women with access to better care that is consistent, high quality, and tailored to their specific needs. Lastly, this policy aims to ensure that all women, regardless of their socioeconomic status or racial background, have fair access to essential maternal health services. This means not only extending the coverage, but making sure that services are accessible, culturally appropriate, and equitable. It's about leveling the playing field so that all women have the opportunity to experience a safe and healthy pregnancy and postpartum period. In essence, this policy reform is about creating a more just and equitable healthcare system where the color of a woman's skin or her income level does not determine her health outcomes. By addressing these specific needs, we can make significant strides in reducing disparity, saving lives, and ensuring that all women receive the care that they deserve. And that is the end of my pitch. Thank you very much for listening.